There you go. Okay, so just start with a bit of background. So about 44% of people with learning disabilities in England live within registered care homes or supported accommodation. And as we heard before, there's many studies that show that people living in these settings can have good quality of life. However, it's recognised that the quality of services varies greatly. So for instance, recent CQC data has shown that around 17% of available placements are within homes rated as inadequate or requiring improvement. While interventions have been developed to improve the quality of residential support, like active support that Christine mentioned earlier, these interventions have been really difficult to embed within services. So the variation in quality in care is thought to be due to poor implementation of community living as a model, but also the specific interventions that are designed to improve quality. So I've been having a think about the factors that influence the implementation of high quality residential support. Implementation science is a field that's emerged to bridge the gap between research and practice. Many frameworks have been developed to help understand the barriers and facilitators to implementation of evidence-based practices. However, in a review of different frameworks, Nielsen has found that 12 aspects of context can be influential in thinking about implementation. Each of the levels of context are thought to be interdependent and affect one another. And I've used this framework to think about which aspects of residential support as a context affect implementation across different interventions. So as we heard from Christine earlier, organisational culture is a key aspect of context which can affect implementation. In group homes, culture has been found to affect implementation of active support. And 5 domains of culture have been identified in group homes. These include the degree to which staff values align with the organisations, regard for residents and the degree of social distance between residents and staff, how staff perceive their role, working practices, which can either be focused on staff outcomes or residents' outcomes, and orientation to change, which include things like an organisation's readiness to change and the amount of feedback that an organisation has on how well they're doing. So studies have found that team leadership, alignment of values and purpose are particularly important and have an impact on activities that people do both within the home and in the community. This work highlights the important role that managers have in supporting staff to work within the organisation's ethos and understand their role as support workers, and kind of connects a little bit with what Andy was saying about whether it's more of a hotel model or a more empowering model of care that people imagine themselves to be working in. The task for managers can be complex sometimes, particularly when subcultures develop within organisations and teams. A number of factors related to how an organisation is structured have also been found important. And again, many of the findings come from active support literature. Better implementation of active support has been found when organisations manage fewer homes, when homes have no more than 6 residents, when people living together have similar needs, as it's thought that staff find it difficult to adapt their practice to people with quite different needs, and when staff have had more training, when more staff have had more training. There's also some evidence that suggests that it's helpful to separate the role of operational manager from practice development.
Okay.
Which suggests a link between organisational support, leadership and culture. One of the factors that stood out for me in terms of the impact of the wider environment on implementation was the availability of the workforce. So there's a really high level of staff turnover in social care for people with intellectual disabilities. about a quarter of providers have a staff turnover rate of 30% and more. So in practice, this means that in a home with 4 residents and 20 staff members, you could expect that 6 staff members will leave every year, or one staff member leaving every other month. So this not only makes it difficult to ensure that staff are trained and implementing good quality care, but it obviously can have a detrimental impact, an emotional impact on people who live there, who can develop strong relationships with staff members. So the impact that staff turnover has on training and workforce needs has become the focus of more recent developments where people have taken more regional workforce development approaches to implementing positive behaviour support. Leadership's a factor which acts across a number of different levels of context and has been the focus of a number of different studies. Within intellectual disabilities, a type of leadership called practice leadership has been advocated. And this focuses on ensuring quality of life is at the forefront of what people do. That practice leaders provide coaching, observation and modelling close to frontline workers, and that they're offering regular chances for reviewing the quality of support. This form of leadership has been associated with how well active support is implemented, as well as residents' engagement in activities and job satisfaction for staff. What's interesting as well is that the organisation needs to be committed to this form of leadership for it to be sustained in an organisation. And it's also thought to have an impact on implementation. The impact of the physical environment on implementation has received less attention. However, qualitative studies suggest that aspects of the built environment, such as the presence of personal effects and how the functions of different spaces are understood by staff and residents, can affect how the spaces are used and the kinds of relationships and interactions that are expected in those places. Quantitative studies have also shown that staff working in more home-like buildings were more likely to interact with residents and support them to do activities in the community compared to places that look more institutional. So this work suggests that the built environment may have an impact on the culture of staff and their working practices. But it also highlights the contested nature of group homes. They're both workplaces and homes, and the need to consider how staff and residents' understandings of this space might interact. So in summary, the literature suggests some common features of residential support that are important to consider, including the aspects of the organisational structure and culture, aspects of the wider environment, including the availability of staff and factors that operate across multiple levels, including leadership and physical environment. Using implementation science frameworks can help explore relationships between different levels of context. They can also draw attention to a broader range of factors that might affect implementation, like the built environment. I think such frameworks suggest that in order to implement interventions to improve quality, interventions really need to address multiple levels of the group home context. And I think, it's been only relatively recently that whole systems approaches to implementation have been trialed. So for instance, there's been whole systems positive behaviour support, which has been operating at the organisational level, focuses at changing whole organisations, and regional workforce development approaches, which aim at changing how people are trained to deliver positive behaviour support in a larger regional area. I think it should be noted that much of the literature is drawn from studies that looking to improve active support or to reduce challenging behaviour And there's been less attention paid to other aspects of quality that people with intellectual disabilities might find important, such as developing and maintaining relationships, developing and maintaining health, and self-determination. And I think just as a final reflection, when I was reading a lot of the literature, it was noticeable to me that many of the measures of quality rarely included the subjective experiences of people with intellectual disabilities themselves. And I think our Feeling at Home project really seeks to address this issue by developing a checklist and understanding what home means for people with learning disabilities themselves, so that they can voice their experiences of their own homes. So that's my presentation. I'll stop sharing now. Yeah, and I'm happy to have any questions or reflections.
Thanks, Tony. We haven't got time for questions. I just checked my emails, and you're very privileged, those who got into the meeting. I didn't realise there was actually a cap on how many people could attend. So unfortunately, it's 100 people. So some people haven't been able to be here. So if it was a colleague of yours or someone you know, please do apologise on our behalf. I think this is a new restriction that Zoom have introduced that I missed. I thought we had an unlimited number of people who could attend the meeting, but apparently it's been capped at 100. Yeah. Bit of a shame. Oh well. Have any questions for Tony, or any comments that you'd like to know and make on Tony's presentation? Donna.
Hi there. Yeah, I'm Donna. I'm from Seeability, and we're a support provider, and we're actually just looking at our own sort of quality of life programme for people we support. And I thought it was really interesting, Tony, you said about quality versus, because everything out there seems to be about quality of support, and even CQC have now got a new quality of life tool and framework that they're
from the periodic table to asking what his shirt said.
Sorry, other people might need to make sure they've got their mics off there.
That's what she said, like, we need a white history.
Deborah, I think it's your mic that, if you wouldn't mind. Oh, I'll mute you. There you go. There you go.
Yeah, CQC have got a quality of life framework and tool that they've just literally issued. But when you look at that, that is, again, it's very much about quality of support. And I just wanted to know, one of the things we're looking at is how the only tool we can find out there where you would actually be talking to people with learning disabilities about their quality of life is the ASCOT tool, the Adult Social Care Outcomes Framework. And I just wondered if anybody knew of any other tools out there where you really do try and capture people's well-being from their direct perspectives, or if that really is the only one. That's the only one we can find.
Yeah, no, I think that ASCOT's really, really good, and I think there's lots of interesting research coming out that's looking at the ASCOT. I think it's quite social care focused, and I think there may be broader measures of quality of life. So, for instance, in my clinical service, we use a very short measure called the Mini-MANS LD. So I think it's eight items that looks across a range of different health and care outcomes. But I think, you know, what I like about thinking about home in this kind of way is it really centers somebody's personal experience as the thing that is the measure of quality, rather than focusing, like you say, on service indicators of quality.
Oh, sorry, Glynis. Yeah, I mean, interesting suggestions in the chat there. I mean, that's always great having such a large audience that perhaps even if, you know, we might have some ideas as presenters, but I can see some amazing suggestions coming up in the mat, some much more individualized, which I think I think we're going to find this a challenge in eliciting very personal, you know, using photographs as a way of kind of expressing very personal views, and how then if we're trying to make that into something a bit more standardized, how that's going to work. That's going to be a challenge for our project. Okay, so we've kind of got back on track with time, so thank you very much. And again,